Hello there, everyone, and welcome to Impact. I'm Darieth Chisholm. The Highmark Foundation recently awarded over $427,000 between two local programs with similar missions. You'll meet Flloyd Cephas, the Executive Director of Northside Christian Health Center, and Amy Parker, the Executive Director of Strong Women, Strong Girls, in a moment. Christina Wilds will also be joining us. She's the Senior Program Officer at Highmark Foundation. She'll tell us more about the grants that are designed to help both of these organizations and several others here in the city. But first, let's listen as a couple of elementary school students deliver a public service announcement about their organization.
Hi, my name is Aaliyah.
My name is Elena. And I'm Lexi. We are in 5th grade at Propamontour.
We think it's cool to care, and so do the people at Strong Women, Strong Girls. The people at Strong Women, Strong Girls work to increase skills in young girls, such as relationships and role models, by
meeting the demand for women's leadership opportunities,
providing much-needed gender-specific programming for elementary-age girls,
and providing role models that teach love and encourage integrity and respect, and how to balance a healthy lifestyle. More information can be found at SWSG.org or by calling 412-596-8879.
Strong Women, Strong Girls, another example of people who know it's cool to care.
It is really cool to care. And joining me now are Christina Wilds, Flloyd Cephas, and Amy Parker. Thanks so much for being here on Impact. We appreciate you being here.
Thank you for having us.
Thanks for having us. Christina, I want to start with you because you obviously are with Highmark Foundation and we're responsible for the grants to support both of these organizations. So let's talk about how that came to be and the cycles of funding that Highmark has so generously provided to many organizations.
The Highmark Foundation funds organizations that are health-related, hospitals, 501c3 organizations. We chose Strong Women, Strong Girls and Northside Christian Health Center because of the value that these two organizations bring not only to the communities but to the people that participate in the programs. We're interested in helping young women become stronger leaders. We're interested in helping underserved or at-risk communities have good health outcomes. So that's one of the reasons why these two programs were selected for funding at this time.
And certainly they appreciate the funding dollars because you both do so much in very different areas. But every dollar counts, and I would imagine in the client group that you serve, young women, young girls, and then of course nearly everybody through your health initiatives on the north side, that it's really important to have this injection of funds. Tell me how it's been working there, north side, and for what purposes the funding has gone specifically.
Well, specifically for this round of funding, we have dedicated the funding to helping us to bolster up our dental facility. We just added back in September of 2011. We bought a dental clinic in full-time. We had done a needs assessment amongst our patients and found that 70% of our patients had no access to dental care. And our physicians were quite frankly sick of hearing of our patients pulling their own teeth. And our children, speaking of children being able to grow up healthy and strong, there was an article that was written in the Pittsburgh Post-Gazette maybe about a year or two ago saying that no child should die from a toothache. So we took that very seriously, and Highmark enabled us to take a clinic that we had opened for part-time to full-time back in September of 2011. And since then, we have already over 1,400 patients with a waiting list. So it helped us to bring on a dentist full-time, a dental hygienist full-time, and this is enabling us to, it is so important for dental care and physical care to be coexistent.
Absolutely.
And because there are so many morbidities that could come about because of
poor oral health,
uncared for caries and and even quality of life.
Yeah. And even in this time, especially, we're still, obviously, many people still strangled in this economic situation and had to make the decision, should I carry my own dental insurance? It's one of the first things I know that people say, I think I can do without that. Maybe I might be able to afford the health, but dental, perhaps, vision, are some of the first two medical necessities that may go by the wayside. In terms of how people then would be able to take advantage of the services, is there a certain criteria, a certain income limit? How are you able to help those that you support?
Well, we are a federally qualified health center, which means that we will take care of anyone regardless of their ability to pay. So we do have a copay, but that copay is based upon the client's, the patient's ability to pay. So they would just simply call our offices. We will set up an appointment. You don't have to be a patient of the Northside Christian Health Center. We would much prefer that you are, because that will allow that continuity of the referral back and forth. With the, I can't tell you how remarkable this has been from a team approach, because the Northside Christian Health Center has received the National College of Quality Assurance Level 3. That is like the J.D. Powers of healthcare delivery. And we are a patient-centered medical home. And so what that allows us to do is, if our physician finds something through a physical examination that needs to have immediate attention by a dentist, we can make that happen just right downstairs. Yeah. And the same with the pediatrics, the very same thing. Which Highmark, they're our best friend. They supplied a phenomenal grant for us back in 2009, whereas we were able to hire a pediatrician. And so that pediatrician came in, and now it's just beautiful how this is all coming together. Yeah. So we serve everyone. And we turn no one away. And
that's a good thing. And we'll talk a little bit more about some of your other services and how this relationship with Highmark continues. But I would like to get to Amy and talk a little bit about Strong Women and Strong Girls and how you're being supported from the Highmark Foundation and some of the things you've been able to do with some girls here.
Great. So Strong Women, Strong Girls is an after-school mentoring organization. We teach 3rd through 5th grade girls that they can do great things with their lives. We do this by raising their self-esteem and their aspirations using a group mentoring model. We have college women who come in and mentor the girls once a week after school. And they go through biographies of women who embodied great characteristics and have done great things with their lives. And this is the vehicle that our college women use to start conversations with the girls, where they go into things like, what do you want to be when you grow up, and really get the girls thinking about what they're going to do with their lives. We've added an element of our program called Get Active. Get Active is a physical fitness and wellness initiative. We decided we needed to capitalize on this great mentor-mentee relationship and have the college women teach the girls how important it is to stay physically fit and eat well. That it's really important to your mental health, your physical health, and your whole well-being. With a generous grant from Highmark Foundation, we were really able to put some legs on this program this year. We have trainers who are coming in and actually working out with the girls, teaching them exercises that they can do at home. They don't need equipment. They can do it no matter where they are. And it's fun activity. I mean, really what the takeaway here is that you don't have to be on the varsity football team to exercise. Exercise is for everyone. Exercise is good for everyone, and it's something that we all need to work into our lives, and it's a fun thing to do.
And it's so important for especially young teenage girls to really understand what it means to embrace their bodies as young teens and get active and move and share in that experience of working out and having fun, because many times they may not be affiliated with a basketball team or something after school or any sports related, but instead of not doing that, they can still find ways to exercise at home or exercise with the other girls at Strong Women, Strong Girls.
Right, right, and we're really excited to take this initiative on, because this is a really high-risk period for girls, pre-adolescent girls in 3rd through 5th grade. They're making a lot of decisions that are changing the rest of their lives and having a really strong impact on their futures. And not exercising is one of them. Not knowing, a lot of these girls don't know how to exercise, or that you can exercise in a way that's not painful or not fun, you know. So we have, thanks to the grant from the Highmark Foundation, we're able to bring in these trainers who are doing amazing things for the girls.
That's awesome. We'll talk a little bit more about that and what's happening with some of the girls. As we continue our discussion here, we need to take a break, so we'll see you on the other side of it. Stay with us.
As a celebrity spokesman, I'm required to exhibit charming yet eccentric behavior. So, instead of a big fat Hollywood salary, I've demanded that Safe Auto pay me, and you guessed it, animal pelts. That means you can still count on Safe Auto to deliver state minimum coverage you can actually afford, and you can count on me to deliver endearing oddball celebrity behavior. 1-800-SAFE-AUTO. Drive safe, spend less. Badger.
And welcome back to Impact. I'm Darieth Chisholm. We're talking with three leaders who are working to improve the health in our community, both of young children as well as adults, through very interesting programs here in the city of Pittsburgh. We're talking with Amy Parker, Strong Women, Strong Girls, and Flloyd Cephas, Executive Director of Northside Christian Health Center, and Christina Wilds, who helped with the funding for two special programs that both of these organizations have been able to take part in through Highmark's foundation and the grants that have been provided. How does an organization reach Highmark and petition for and receive these very generous funds?
Okay. Well, it can come about in so many different ways. Typically, an organization can check our website to find out, that's www.highmarkfoundation.org, to find out what kinds of programs we funded in the past. If their program is a fit, we ask them to send a letter of inquiry, and then from that letter of inquiry would be, a committee would decide whether or not we would accept a proposal. Sometimes we issue requests for proposals, which are called RFPs. Sometimes we'll hear about a program that we may be interested in, and we'll actually go to the source, to that organization, and say, we're interested in your program. Can you tell us a little more about it? So there are a couple of different ways that organizations can be funded.
And these have to be nonprofits?
Nonprofits.
Okay. In relation to then how long that process takes, and this, of course, would be any nonprofit out there that's watching that's interested, how long is that process?
It depends. It depends on the readiness of the organization. Typically, if an organization is interested, you know, we do a lot of behind-the-scenes work, like site visits or phone calls, just to make sure that whatever they're proposing is a fit for the Highmark Foundation. It has to fit in one of those 4 funding categories. It has to be health-related because we are a health-related foundation.
And share with us the funding categories again.
The funding categories are chronic disease, service delivery systems, healthy communities, and
see if I have my list here and can help out. Healthy communities, family services, chronic disease, and service delivery. Service delivery. There are 4.
Service delivery, yes.
And in this case, and we were talking with both Flloyd and Amy, 2 very different programs, but certainly within the health category. You've seen a remarkable difference in perhaps the people that you're serving, the young girls as well as your patients, through this.
Yes, we have. We are very interested. That is one of the impetuses of why we wanted to bring in a pediatrician. We have physicians, family practice physicians that see both children and adults. But what was happening is we had a third of our patients are children, and we had adults that were on a waiting list, waiting to be seen. And we felt that if we could bring in a pediatrician that could see those children, then that would open up our schedule so that we could bring adults in and they could be seen in a more timely manner. It was tough having patients on a 3-week waiting list. That's really tough. But this way we were able to, we established a child wellness program, and this was the catalyst of our being able to address in more of a focused endeavor of childhood obesity, juvenile diabetes, exercise programs, things of that sort, where we could have the parents involved with these very important developmental milestones that children need to have, such as the shots, making sure that everyone is immunized at the prescribed times when that should happen. And so with that grant, it also helped us to we have 2 sites. We have a site up in the Northview Heights public housing complex, and we are the only community health center located in a community housing complex, and there are many children there, and we are able to serve them with joy and to be able to serve them culturally responsibly, and we're getting good results and outcomes.
And where's your other location?
At 816 Middle Street on the north side. It's right across from, I don't want to plug a place, but it's right across from Max's Tavern. It's a iconic place. But we began in 1995 on East Ohio Street. It was an old funeral home, and it was donated to the organization by PNC Bank. And then when we found that the place was just too small, we had to move.
And had to get into a different
we got
place
into a different skin.
Yeah. And Strong Women, Strong Girls is located where, and how do girls get involved with that?
So our office is located in the Hill District, right on Center Avenue, but we run our program out of 26 elementary schools and community centers in the Pittsburgh area: Pittsburgh, Stowe Rocks, Steel Valley, and Wilkinsburg.
And so when children are interested, girls are interested, they stay after school for those particular days that the program is being offered?
They do. We run once a week, and the schools handle the enrollment and the recruiting of the girls who might be good fits for the program, and the girls stay after school and participate in the program once a week.
Let's put the information on the screen if you're watching and you'd like to get some more information about Strong Women, Strong Girls and how you can approach your school and enroll your daughter. You can always at least start there with the web address on the screen. If you're also interested in learning more about some of the health services offered to you at Northside Christian Health Center at either location, you can go out to their website there to get the information that you need for either of those 2 programs. Highmark is certainly a very strong and supportive health company initiative here in the Pittsburgh area. Probably could name a few different things that are associated with the name Highmark. But every time we have someone on from Highmark and all of the very different interests that Highmark is involved in, I'm always so pleased to see that you find quality organizations to support, and that the dollars that you give to them in terms of grants go so very far, and in this case 2 wonderful organizations.
Yes, it does. At the foundation, being that we are a health-related organization, the health of all of our communities, regardless of whether you have insurance or you don't, it's important. And it's important for everyone to have to be able to take advantage of preventive services as well. You know, exercise, that's good, you know, having immunizations, but it makes for a healthy community, because when the community is healthy and productive, the people in it are able to be able to do more and able to give more. And that's important.
And it has to start at the grassroots efforts. I mean, these 2 are programs that are definitely grassroots. We're talking about right after school or right in your neighborhood, and being able to walk right into it. And so when you find those organizations to support, it's about getting in at grassroots and helping to build a healthy community.
Right. That's right.
Yes, certainly. Well, we have run out of time, but I thank you so much for being here on Impact. Come back, keep us posted on how things are going at both of your places. And we always have Highmark on for some reason or another, so we know we'll see some representative from there. But we thank you so much for being here on Impact. And we have more Impact for you ahead in just a moment. Stay with us.
I'm